Auditory processing disorder is a disorder that affects the way that the brain processes sounds. Children with APD have normal hearing, but they might have a difficult time distinguishing between speech and background noises. They might have a hard time concentrating when there are background noises, and they may have difficulty pronouncing certain words. They might also have trouble distinguishing between words that sound similar, like shoulder and soldier, and they might also have a hard time when people speak with an accent or speak too quickly. At present, there is no clear way to diagnose APD other than ruling out disorders that may have similar symptoms, like ADHD, specific language impairments, or hearing impairments. Children who are diagnosed are typically diagnosed at around school age, but a lot of children are misdiagnosed or not diagnosed at all due to lack of awareness about APD. The cause of APD is not entirely known. Sometimes it can run in families, so it may be genetic, and some children who have had a history of middle ear infections develop APD later on. It can also occur as the result of a traumatic brain injury. Children with APD tend to struggle in school because of the loud environment. They may end up being labeled as the child who can't listen or follow instructions, when in reality it's just that their brain isn't processing sounds correctly, making it really difficult for them to follow along with what's happening, especially when it comes to following verbal instructions. While we can't cure APD, there are a lot of things that we can do to support children who have APD, like environmental adaptations, strategies, and certain tools. Children with APD tend to do better when they're seated closer to the teacher, facing the teacher directly. It's important to limit background noises as much as possible, including music or even noisy fans. When the teacher is giving instructions, they should speak clearly and look directly at the child, and if they're using multi-step instructions, then as much as possible they should use visual cues like gestures or pictures to help support the child's listening. One of the tools that I use when I'm working with children with APD is the Forbrain. Forbrain is a wireless altered auditory feedback device. It has a microphone, a dynamic speech filter, and it uses bone conduction to stimulate the auditory nerve directly. So when we wear it, we can hear ourselves in real time, but just slightly louder. When I introduce the Forbrain to a child with APD, I like to just explain it to them first and show them how I wear it. I'll then ask them if they would like to have a turn wearing it and place it on their head. I like to have a mirror present so that they can see how they look when they wear the Forbrain, and if they're a little bit sensitive, I might keep the volume turned down low to begin with. Children with APD can benefit from wearing the Forbrain in two different ways. The first way is to have the child wear the Forbrain, but to point the microphone towards the therapist or teacher's voice when they're speaking. In doing so, the microphone will pick up the therapist or teacher's voice. It will be filtered through the dynamic speech filter, which filters out some of the background noise, and it will be easier for the child to distinguish between the speech and the background noise. The second way involves a process called the auditory vocal loop. The auditory vocal loop is a naturally occurring process that we all use every time we speak. We speak, we perceive our speech, we can analyze what we've just heard, and then we can adjust our speech based on what we've heard. Some people with APD have a really poorly functioning auditory vocal loop, meaning that the brain has a difficult time processing what it has heard. When we wear the Forbrain, we are boosting our auditory vocal loop because the speech signal is so much more salient and easier for the brain to then process. This can help children with APD learn to pronounce certain words that they've had a harder time saying before and learn to speak more clearly. This can help children with APD learn to speak more clearly and even learn to pronounce certain words that they had previously had a hard time saying. Once the child is comfortable wearing the Forbrain, I like to use it regularly in my speech and language therapy sessions for about 10 minutes per session or for as long as the child wants to keep it on for. I'll use it during the activities that I would do with any child with APD, but just include the Forbrain. Things like playing games, reading books, listening to my voice following instructions, and repeating back instructions into the microphone. Alongside the environmental adaptations that I give to parents when I work with children with APD, I will also recommend investing in a Forbrain to use outside of speech and language therapy sessions so that the child can continue to have their auditory vocal loop boosted. Just as I would use it in my session, I recommend trying to use it for about 10 minutes per day during activities where the child needs to listen and concentrate. APD is a complex disorder that we don't yet fully understand, but thankfully there are tools and strategies that we can use to help these children. I'm really happy to have the Forbrain as part of my therapist toolkit that I can use when I'm working with children with APD to help them listen, learn, and thrive in school.